So for the majority of patients with asthma, mostly mild to moderate asthma, there's no need for imaging of the chest. However, in patients with uncontrolled asthma and especially severe asthma, there is an indication to perform a high-resolution CT scan of the lungs without contrast. So there's no need for intravenous contrast administration. And this imaging has two roles. In the differential diagnosis of asthma, we need to exclude some rare diseases. And then secondly, if asthma is confirmed, then we can look for mucus plugging or other signs of small airway dysfunction which are seen in severe asthma. But it's important to exclude, for example, bronchiectasis or emphysema or interstitial lung disease, so other diseases which can either mimic the symptoms of asthma or which can aggravate the symptoms of asthma in a patient with diagnosed asthma and confirmed asthma. So if we perform diagnostic tests, they should always have therapeutic implications. So that's why in the majority of patients with mild to moderate asthma, we do not need imaging. However, in patients with uncontrolled severe asthma, there's absolutely an indication to perform imaging of the chest by CT scan, ideally by high-resolution CT scan of the chest without intravenous contrast administration. And the aims are twofold. So first, we want to exclude other diagnoses which could mimic the symptoms of asthma, for example, bronchiectasis or interstitial lung disease, lung fibrosis. And secondly, in patients with confirmed asthma diagnosis, it's important to investigate the presence of mucus plugging or other signs of small airway dysfunction, for example, air trapping, which will impact the course of the disease and which needs a more aggressive treatment and also a closer follow-up of the patients. So there are different imaging procedures, but if we use a CT scan of the chest, this is, of course, using radiation, and we want to avoid this exposure in young women especially, and that's the reason why we will limit the use of CT imaging, especially in young adults and children with asthma. Of course, in patients with severe asthma, we need to have a proper diagnosis, and then a CT scan is indicated. And of course, we evolve now to low-dose CT imaging using less radiation for the procedure.